Okay, hello, I'm Lizzie Knowlton, and I did my first career profile on marriage and family therapy and just as a general therapist. And I didn't look into a specific organization because I wanted to know more about the job generally than at a specific center. So I did get in contact though with um, a therapist. They are a social worker. And so even though it's a little bit different than what you'd be doing as a marriage and family therapist, I wanted to know their take on therapy in general because that kind of um, is the most interesting part of the job to me. I wanted to know how it affected like personal life and family life outside of out of the work environment. So that's kind of where I spent a lot of my time questioning them. Anyways, a typical work environment for marriage and family therapists can be anything from a clinical practice where they're working under an organization name, or they can have their own private or group practice. So there's pros and cons for each one. Um, Pros for being in a private practice is, you can declare your own days off, you can pick the clients that you work with. There's lots of benefits, but there's also, you're working for yourself, so you don't really get the benefits of having days off without not getting paid, and you have to supply your own benefits, whereas in a clinic, often those things are provided. Um, some typical stressors that I found out about the job were paperwork. That's not something that I had really considered as part of this job, but for every client that you have to write up notes. And from what I understood from my research and from the therapist that I talked to, when you're working in a private practice, the notes are a little more intensive because you also have to be working um, with the insurance company, so your notes need to be very thorough. Whereas um, in a clinical practice, you take notes on your sessions, and then there's also people that are working with insurance in the clinic. That's their specific job, so it's a little bit less of a stressor in that sense. Um, Also, something that I found that commonly was mentioned was the fact that um, a lot of times people felt guilty about taking time off because their clients really needed them. They needed to have their sessions with them. And so that was something that I found interesting, that people felt uncomfortable taking um, their time off because they didn't want to feel like they were abandoning their clients. Um, the other thing that I found was that sometimes like home life in general was a little more stressful because you spent the whole day counseling people with their problems, and you came home, and the counselor that I talked to, or the therapist that I talked to, said, sometimes I come home and I don't have any words left. Like, I can't communicate as effectively. I can't be there to support in the same way if it's been a particularly stressful day at work. So I thought that was an interesting note about the profession. Typical benefits, I had a little bit of difficulty researching those. In a clinic, often the benefits are provided, as I mentioned, and if you're working in a private practice, those are often provided through your own setup, and so it just depends. Outside of like retirement benefits, there's the benefits of the job just working with people. Common job tasks include meeting with people for hour-long sessions, whether it's individually or in a group or with a family or a couple. Dealing with anything from chronic illness to, I found people that dealt with ADD or ADHD or drug use. Just you deal with families in times of hardship or need, and try to help them be more successful in general. The educational requirements, as we've learned in some of the videos, it's a master's degree is the best education, as well as going on and getting your clinical experience. And the clinical experience requirement changes from state to state. So most of all, the most interesting thing that I found was talking to the therapist that I was in contact with, was just her insights in how providing therapy to people really affected her. And I'm someone that I wanted to know how that would kind of be for me. She talked about how some people are really easily able to separate work and like home life, and she was not one of those people. And so sometimes it was she needed a break, and so she worked in a clinical setting so she could have those breaks. Other people who work in individual settings, maybe they take time off, or maybe they're able to more successfully separate those two lives. But I knew that that would be an issue for me, because I often like if one of my own friends is going through something, or someone in my family, I think about it a lot. So I wanted to know how that affected her. So overall, I think I found that although the occupation is really interesting to me, it might not be the best option for me in the marriage and family field. And so that was good to learn, because I didn't really think about doing anything else. So it's good that we have another career profile to research. Anyways, yeah, that's my career profile on marriage and family therapist. Thanks.